Now you probably know that the budget bill that was passed by Congress this month and signed into law by President Trump on July 4th includes nearly $1 billion in cuts to Medicaid, as well as a bunch of other health policy changes. And many Republican members of Congress were very worried about how that was going to impact midterm elections. But let's take a look at when those changes actually take place, because I'm not sure if it's really going to be the game changer people think it's going to be during the midterms. The reality is that a lot of the Medicaid changes and changes to the Affordable Care Act are backloaded, so they won't actually take effect until after the midterms. It's not like between now and the midterm elections in 2026, millions of people are going to wake up and find out suddenly that they've lost their health insurance. For example, Medicaid work requirements won't kick in until 2027, and some states may even receive extensions that, let the effective date go beyond 2027. Another change in the bill is an increase in the frequency of Medicaid eligibility checks, moving it up to every 6 months, but that provision doesn't take effect until December 2026. The bill also includes a $35 cost-sharing provision for people who are in the Medicaid expansion, meaning that they'll pay $35 per service. It won't be 100% covered, but that doesn't kick in until 2028. The phase down of Medicaid provider taxes and state-directed payments, which states use to help fund their share of program costs and which rural hospitals have really come to rely on, don't go into effect until 2028 either. So that's Medicaid. If you have coverage through the Affordable Care Act, you will see changes a lot more quickly. For example, there's about a 7.5% increase in the premiums that you're going to be expected to pay, and that change will take effect at the beginning of next year. So also Medicaid funding of Planned Parenthood will get cut off in January of 2026. So that could lead to more than 200 clinics closing, which of course is an effect that would be felt before the midterms. Restrictions on which lawfully residing immigrants can access Medicaid coverage will go into effect October 1st, 2026. So that's just before the primaries. So if nothing changes, it'll take 9 years actually for the full provisions of the bill to go into effect, because I talked about when they start, but some changes are phased in over time. That's what's in the bill, but that doesn't account for how the market will react. For example, one rural community hospital in Nebraska has already announced its intention to close in anticipation of those future Medicaid changes, knowing that it will not be viable in the after scenario. And many Congresspeople, including Josh Hawley from Missouri, have said that they're going to do everything possible to reverse these Medicaid cuts. 9 years is a lot of time. It may not ever fully take effect, but that's what's written into the law right now, and that's the schedule.